Hello. In this film I'm going to have a look at some of the ideas about the causes and the treatment of disease in the medieval era, so that's from around the year 1000 to around the year 1500. This is for the AQA GCSE History course and it's for the unit Health and the People. During the medieval era there are three main ideas, main theories on how disease is caused. So dominating much of this period are the belief in the supernatural, a belief in religion causing disease and illness, that sometimes God shows his wrath, shows his anger with humanity by causing disease and illness to spread. And of course, if you look in the Bible, there's examples of when God does cause disease, such as the plagues that he sends on Egypt, to show his anger, to show his wrath, for want of a better word, with the people. And so it's easy to understand why there were lots of people that thought that God was one of the causes of some of the disease. However, there was another theory which dominated this period, which stemmed back to ancient times. So there was an ancient Greek physician, a doctor of sorts, called Hippocrates, and he had this school of medicine where it wasn't just Hippocrates, but there were lots of doctors that followed his style of diagnosis and his style of treatment. Hippocrates believed that you simply had to study somebody in order to decide on how to treat them, that you had to look at the symptoms. Hippocrates did not think that religion, supernatural reasons, made you unwell. He didn't think the gods made you sick. Hippocrates instead decided that it was to do with an imbalance in your body. Hippocrates and his school of doctors theorized that the body is made up of four humours: yellow bile, black bile, blood and phlegm, and that all one had to do in order to make somebody well was to ensure that these humours were in balance with one another. So this is where we get the idea of bloodletting, that you would bleed somebody in order to treat them. Centuries later, there is a Roman physician, a Roman doctor called Galen. And Galen, we know, dissects animals, probably pigs and apes. He also works for some time at a gladiator school as well, where he may have dealt with injuries that allowed him to see within the body. Although Galen almost certainly doesn't dissect a full human body, because that was seen as something that was forbidden at the time. Now, Galen also believes in these ideas of the four humours, but he goes a bit further. Galen develops it further into this theory of opposites, that therefore if a humour is out of balance, or you would treat it with the opposite. For example, if somebody was very, very hot, you might treat them with something that was very, very cold. That was his idea. That way you were balancing out their symptoms. You were balancing out the symptoms, which would therefore treat the disease. Now, the four humours and this theory of opposites is the dominant view in medicine for centuries. It's the dominant view over religion in medicine for centuries. And importantly, the church quite like these ideas, because this doesn't challenge any of the teachings of the church. So the church will propose these ideas as well, and they will propel these ideas. They spread these ideas. There is also, and this is perhaps a bit more logical, the idea that if something smells bad, that could be the cause of disease. Bad smells. They do have this idea of it, and we see that in the way that they try to tackle waste in some towns during this time, as I'll discuss later, and we also see it in the way that they try and tackle things like the plague, the Black Death, which I'll discuss later as well. But the key thing is that religion, the four humours and the bad smells, they really dominate beliefs in the cause of disease of this era. They simply do not know what is the true cause of disease, such as germs, that we understand today. Now, because they therefore think it's four humours or it's religion or it's bad smells, their treatments are perhaps not always going to be that effective, because they haven't worked out the true cause. But you need to understand that treatments are based on their assumption that these that you see here are the true cause of disease. There's a range of people that you might encounter in medieval England that would help treat you if you were unwell. Now, who you sought treatment from depended on where you were in the country, and it depended on how much money you had. For the vast majority of people, they're probably going to what we would call the lady of the house. So your wife, your mum, or maybe it's even you if you are one of those people. You're going to somebody that has just learnt how to do certain treatments, first aid, from their family. They've learnt it from their mum, they've learnt it from their grandma, they've grown up with this. They would provide you with some basic treatments. Maybe they might know some herbal remedies. Perhaps they might go to, or you might go to, visit a wise woman. Now, this isn't an official job or official title, and even they themselves may not have called themselves wise women. But I'm talking about somebody that was usually older, and it's not always a woman, by the way. It sometimes was men. Somebody that's usually older, that's more experienced. Perhaps they've had a family and their family have grown up and left the house. Perhaps they've still got a family, but they've got experience, they've got knowledge. This is often the case in rural areas. These people had wide-ranging knowledge, but no formal training. They would know about the use of things like herbal remedies, perhaps, some of which we do know were effective, were useful. But there might also be a lot of superstition attached to their treatments too. Now, if you had a bit of money, and if you lived perhaps in a town, then you might get access to things like apothecaries, barber surgeons and physicians. So let's talk about each of those. Apothecaries are perhaps what we would call today a chemist. These are people who actually had very good training. They usually were an apprentice for about 7 years and therefore gained a very wide knowledge of herbal remedies. And they were a lot cheaper than visiting a physician, a doctor. There's also a lot more of them than physicians and doctors as well, and they're fairly easy to access in the towns if, and it's a big if, you had the money. So for many people who are more poor, and especially people that lived in more rural areas, they're not going to access apothecaries. But for those that have a little bit of money and those that live within the towns where the apothecaries are, they are going to be able to access them and to get the herbal remedies that they have to treat various illnesses. Apothecaries also sometimes carried out bleeding at times too, although for most stuff like that, including minor surgery, dentistry and amputations, you're going to go and visit the barber surgeon. Barber surgeons are exactly what they say. They are barbers, they dealt with cutting hair, but they also had a sideline, if you like, as surgeons as well. They weren't amateurs. They were often people who had gone through years of training as an apprentice. And they're usually quite expensive for their services. And the reason why, by the way, they end up with barbers carrying out surgeries because they had a lot of the tools that you would need. They had a lot of the sharp knives and the scissors, the blades, the razors that you would need to cut open skin, to cut bones apart and so on. And they were often quite skilled. But, as I'll discuss in a moment, remember that surgery during this time is incredibly painful because there is no real effective pain relief. On top of all of this, the person that most of us today might go and visit for treatment is actually very rare in medieval England, and that is the doctor, known as the physician at that time. Doctors do exist in medieval England. They had often gone through years of training at university, but much of their ideas were based on Hippocrates' teaching of the four humours and Galen's teaching of the theory of opposites. They might use things like a urine chart, so looking at the colour of your urine and studying it against a chart to diagnose your illness, or perhaps a zodiac chart, so there was an element of the supernatural, of the astrological in this, as they looked at the movements of planets, the positions of stars, to try and diagnose your illness. So you can see how their ideas on the causes of disease end up influencing how they treat people. Physicians are rare in medieval England. There might be one or two in some of the towns, some of the smaller towns, and the bigger towns might have more, but because they're very rare, they're also then very expensive. And that means that only really the very wealthy are accessing a physician. For the vast majority of people, as I said at the start of this, most are going to visit the lady of the house, most are going to rely on themselves or the wise woman, and actually a lot of people are going to probably put up with illness much more than we would do today. they're going to suffer a bit more than we do today because there is no alternative, there's no other option for many of them. So I was talking about barber surgeons and how they would carry out minor surgery. They were the ones that would deal with amputations, and they were the ones that deal with dentistry. Physicians, by the way, the doctors, they are not carrying out surgery during this time. They are not doing that kind of job. That's seen as primitive to them. It's seen as amateurish. It's not, in their view, it's not based on the real causes of disease, which, remember, they think is about balancing humours. It's seen as a little bit scruffy and dirty, and in a way it is. When it comes to surgery, there's always, throughout the history of health and the people, this course that we're studying, there's always these three major challenges that have to be overcome in order to carry out surgery successfully. So you have pain. How on earth can you deal with pain so that you can keep a patient still and carry out an operation without them flailing about, so that you can ensure that they don't pass out from the shock of the pain? Pain is an enormous problem because it might mean that you have to carry out surgery incredibly quickly so as to lessen the suffering of the patient. But of course, if you are doing it incredibly quickly, you might make more mistakes, and that's an issue. The other problem is all about blood loss. How on earth do you stop somebody losing too much blood? Because it was known that if somebody lost too much blood, they would die. Therefore, you've got to find a way to try and stem the flow of blood, to try and stop blood pouring out of them when you're carrying out surgery. And the final issue is that it was known that even after somebody had had surgery successfully, you'd perhaps amputated something or even committed a very minor operation on them, it was known that still somebody afterwards might then become unwell and die. Now, we know today that's because they might become infected. They might develop an infection. Now, of course, they do not understand how infections develop at the time because they're still based on the idea of the four humours. And because they're not really certain of infection, the treatments they have for it are not always effective, although sometimes, as I'll explain in a moment, they did work. So how do they deal with pain? Well, the drug opium is used an awful lot to lessen pain, but it's really difficult to get the quantity, to get the dosage of it correct, so that even if you gave somebody the opium, it might not be enough to knock them out. It might lessen the pain for a bit, but then it would wear off and then they'd feel the pain. They might get too high a dosage and that could cause them even greater damage and possibly even death. They might get too short of a dosage and wake up during the operation whilst you're then cutting off their leg. So you can see how it's used, but it's a bit haphazard. And some barber surgeons use it, other barber surgeons don't use it. It depends on where you go, and obviously it depends on how much money you've got as well. There is the English physician John Ardern, who develops this idea of using some form of herbal ointment to lessen pain during surgery. So rather than giving them opium or getting them blind drunk, you mix these herbs together and you rub it on a particular area that you're performing surgery, and it seems to lessen pain. What Ardern seems to have discovered is what we would call today a local anaesthetic, some kind of numbing cream, magic cream as you might have called it if you'd have had some cream on a little cut as a child, something that numbs a particular area. And he seems to have discovered something that does that. Now, he can't explain why it does that, but it seems to work. And he even writes a book, The Practice of Surgery, to spread his ideas. So there is some progress there. Blood loss is trickier to deal with. They have no way of replacing blood from somebody who has lost too much blood. So it all becomes about trying to prevent them losing too much blood in the first place. And the most common practice of doing that was the use of cauterization, which had been around for a long time. So this was where you would heat up a piece of iron so it's red hot, and you would place it onto the wound. So let's say you've cut somebody's leg off, amputated it, you would burn the wound with a red hot iron. You can imagine the pain must have been excruciating, but it would seal it. The burn would seal it and therefore stop the bleeding. The problem that it causes, which they don't fully realise, is that if they've then become infected, the infection is sealed there inside, of course. So infection could still go along and kill them afterwards, but they don't really understand that. They do have this idea that even if you've done all those other bits successfully, you've dealt with the pain, you've dealt with the blood loss, that people can sometimes still become unwell. They're not really sure why. But it's found that if you pour some form of alcohol, and wine is commonly used, onto these wounds and avoid cauterization, then the alcohol actually acts as what we would call an antiseptic. Now, they're not using the word antiseptic. They don't know anything about antiseptics. That would be an alien idea to them. But they somehow have the idea that actually if you just pour this wine on it, somehow the wine seems to do something to prevent them becoming sick afterwards. And that's because it's acting as an antiseptic, but they don't know that. So they know that somehow it seems to work in some cases, but they're not really sure how. So there's some progress in surgery, but they still really haven't overcome these three main challenges of pain, blood loss, and infection. The role of the church in the medieval period is often debated amongst historians, and the key argument is, did the church assist medical progress or did they limit medical progress? And the answer is, well, they did a bit of both. Remember that many of the ideas about the causes of religion are based on religious ideas, and they're put forward by the church. The church promotes these ideas. The church promotes the ideas of Galen and of Hippocrates, of four humours and theory of opposites and balance and so on. So in some ways, the church is actually very important for medicine. Remember that a central idea of Christianity is care for the sick. You care for the sick. That's one of the central teachings of Christianity even to this day. And there would have been hundreds of monasteries across England which often had a hospital which cared for the sick. In fact, the very first hospitals that we have in England are set up by the church, and some of these still exist today, like St Bart's St Bartholomew's in London, and St Thomas's. St Mary of Bethlehem, better known as Bedlam, was a hospital that was set up by the church. And some of those, like Bart's and St Thomas's, they still exist today, and they were originally created by the church. They're created by monks. It's also important to recognise that most of literature during this time, most of writing during this time, is done by the church. It is at the monasteries that were not just centres of prayer. They weren't just centres where you could get care, but they were also centres of learning. So libraries existed at these monasteries, and many books are copied by these monks, including lots of Arabic copies of texts of Galen and Hippocrates' work that had actually been lost in parts of Europe during the Dark Ages. So the Dark Ages is the period just before the medieval era, from around 400 to around 1000, a period which sees the Romans having left Britain and left much of Europe, and what's called the so-called Dark Ages, or which sees many of the ancient texts, of the texts of the ancient world, sees many of them lost from parts of Europe for centuries. Now, these texts had been preserved in many Arabic countries, particularly in cities like Baghdad during the Islamic Golden Age around the year 900 to 1000. And these texts are then able to be accessed by the monks across Europe, who then copy these and spread them to other monasteries. So we need to recognise that influence of the Arab world in helping maintain medical knowledge across Europe, and how the church plays a really important role in that, in ensuring that those texts are copied and spread, because there's no way of printing it at this time. You have to handwrite all of these texts. It's also important to recognise that the work of Ibn Sina, known as Avicenna in the very crude translation of the name into Latin, Avicenna Ibn Sina was an Arabic physician, an Arabic doctor, who wrote a book about studying the body and about possible treatments for people that became very popular. It was, we would call it today, a much more scientific work, much more based on logic and reason. And his ideas are spread across Europe during this time as well. We also know that as these monasteries that existed in England and across Europe, as these monasteries are centres of learning, it was often monasteries that established some of the first universities. And at the universities is where you have these physicians that are trained. So the church does play a very important role in actually assisting medical progress. But do remember that their assistance in medical progress is based on the assumption that disease is caused by an imbalance of the humours, or disease is sometimes caused by God, or that disease has to be treated by this theory of opposites. In some ways, the church does limit medical progress, and there are few that perhaps challenged this at the time, although there is one exception that you'll see on the slide and I'll talk about in a moment. Dissection of human bodies was generally not allowed during Europe at this time. The human body was seen as inviolable. You could not go and desecrate God's creation. You couldn't go and just start cutting it open. It's God's creation. You had to respect that. And people, when they died, were usually buried. Their bodies are meant to stay there. It's seen as you are careful, you are respectful of the dead. So therefore, the idea that you would dissect a body afterwards was seen as very much forbidden. However, that we know that Galen in the ancient times did look at work at a gladiator school, and he was able to look inside bodies, so they had some knowledge of it. Anyway, back to the church. There were people who began to challenge some of the church's teachings. See, the church, as I've already mentioned, propelled the ideas of Galen, who wrote about the human body. But Galen didn't dissect a body. We're almost certain of that. He almost certainly dissected pigs and apes, monkeys, and he bases his teachings about the body on his dissections of animals. And the church likes these ideas because they don't really challenge much of the ideas of the church. So the church propel Galen's ideas. There are some that begin to question this and ask whether Galen was really accurate or not. And one of those people was a monk and a lecturer at Oxford University called Roger Bacon. Now, Roger Bacon, he wasn't questioning the teachings of the church, but he questioned whether Galen was entirely correct. He questioned whether perhaps Galen might have made some mistakes. And over several instances of this happening, of his questioning, he actually is imprisoned for a short period of time. Bacon is imprisoned for a short period of time because of his questioning of the teachings of the church regarding Galen. The emphasis of the church is on, well, we pray and we wait. So prayer and patience, that's what we do. And the idea being that, well, God will just heal them. You know, God will heal them. We pray and we will wait and God may heal them, rather than intervention. Having said that, you know, we know that at some monasteries they do have very good stocks of herb gardens, which they would use for herbal remedies. But by and large, it's a wait and see kind of treatment that they have, which could be seen as a way of limiting the progress that's made. So we've looked at what they thought caused disease, and we've looked at some of the people and the ways in which they would treat that disease, and we've talked a bit about how the church could be seen to both assist, help medical progress, and how in some ways it hindered, it held back and limited medical progress. Let's now have a look at one of the other major areas that's worth considering, which is public health. When I say public health, I mean the environment around us, the streets around us, our homes, and about who makes sure that those areas are hygienic, are habitable, are cared for, so that we have the best chance to have good health. Now today, we have this expectation that that is the government's job. we pay our taxes, we expect the government to make sure that we have a clean and safe environment in which to live and work. But that's a very modern idea. 1,000 years ago in the medieval period, that idea does not really exist. People do not have this expectation that the government is there to look after you. It is largely down to you, although in some areas there are examples of councils taking action, of different towns taking action to try and improve the health and well-being of the people that lived within their towns and cities. Medieval towns were busy, bustling places, and there are many problems that we find in there which we would recognise today as hazardous to your health. Sewage often ran in open sewers, so it would be at the edges of roads in the gutters, but it's on the surface. These are not buried down in pipes. There were very few underground sewers, and those places that did have underground sewers, many of them dated from the Romans from centuries earlier who had built them. In most towns there are no such underground sewers. The sewage flows on the surface. Now immediately today we would recognise that that would contain all sorts of germs for disease, but they do not believe in the idea of germs. Germs would mean nothing to them. They do have this idea of bad smells though, remember. So they do have this idea that, well, if that smells bad, maybe it's a cause of it. So they do recognise that sewage on the streets isn't great, but then how do you get rid of it? And it requires a lot of money to build underground sewers, which people are generally not wanting to spend. So instead, you're perhaps sweeping it away. You're trying to brush it out towards the edge of the town instead of leaving it onto the streets on the surface. But in a busy town, there's a lot of waste. It's going to fill up quite quickly. On top of that, there would be animals everywhere in these towns, much more than we're used to today. These are busy places. Animals are brought into the town to be slaughtered, to be used as food. They're brought into the towns to be used, to be bought and sold. And you have animals brought into the towns pulling along wagons, whether that be oxes or whether it be horses. And there's a lot of waste. There's a lot of waste that they generate. And that piles up on the streets as well. And on top of that, you have a lot of shops, a lot of food sellers that are there, butchers, bakers, lots of them that are about in the town. And they are slaughtering the animals at the butchers on their premises. So it's not like the world today where we have slaughterhouses that are like a factory elsewhere and the meat is brought to the butchers already slaughtered. The animals are often brought to the butchers alive and they're slaughtered in the butchers. But of course there's much of the animal that you do not eat, the carcass of it you don't eat, and the carcass is thrown out onto the streets. So it would be very common to walk down the streets and to find carcasses of bodies that are there, and of course flies that are buzzing around them and so on. Now we would recognise that today as a real hazard to our health. But at that time, remember, they do not really understand the true cause of disease. So whilst they know that bad smells, they have this idea that bad smells is a bit of a link to it. There's simply so many of these carcasses of animals and so much animal filth and waste and so much sewage that they can't really deal with it all. There are some areas that offer some limited solutions. It is limited. We have one or two examples. There is no direct national government involvement in this. There's no direct national government initiative to tackle it. It's down to different towns and people within those towns to decide whether they want to do something or not. There was no law which forced them to do anything. It was simply up to them. Put simply, many towns do not take action because it would cost them money. And to raise the money, they would have to take it as taxation. And people don't like paying taxes, do they? It would be unpopular. And so in many areas, it simply isn't really tackled. There's some evidence that in some towns there were bathhouses that had continued to be in use since the Roman times. So the idea that there is some cleanliness there that you could go and access. And we know that in some towns, they did establish designated areas to dump waste as what we would call landfill sites. These tips, they do designate certain areas of that, and you were only allowed to go and take your waste to this one place. but it's a bit limited. We also know there were some towns which did have a street cleaner, and often it was just one man, and they might collect money from people living in houses on a particular street to clean their street, make sure that it was cleared of waste. And we also know that in some towns, such as Coventry, for example, they passed laws, local laws, to try and clean up the river and to fine people for dumping waste in the river. But as to how effectively that's enforced, we simply don't really know. And of course, if you've got somebody new in the council that actually didn't like that, they might just go, we're not doing that anymore, we're going to do something different. So public health, there's a lot of hazards and there's not that many solutions really. And what solutions do exist are very limited and very patchy across the country. Finally, let's have a look at the Black Death. So this is the plague that spread across Europe in 1348. Plague becomes almost a constant problem over centuries. It never really goes away, and in fact it still exists in some parts of the world today. But there are moments in England where it becomes what we'd call an epidemic, so it spreads wildly out of control and can't be stopped. So one of those moments is 1348, where it spreads very far and wide and kills perhaps a third of the population of England. Some estimates put it as high as a half of the population of England. We simply do not know for certain. People still debate today about what exactly causes the Black Death, but that's not really the interesting thing for us. It's not what we need to focus on. What we need to look at is what medieval people thought caused it. So think about what I discussed earlier. Bad smells, four humours, religion, God. That's all key ideas about the beliefs of the cause of disease, but there are some ones that are a bit more sinister, a bit more scary. So during this time, there was a lot of anti-Semitism in many parts of Europe, especially in England, lots of anti-Semitism, and there were rumours that spread that it was Jewish people who had poisoned the wells, who'd poisoned the water supply. I mean, complete fabrication, completely made up, but if nothing seems to be working, you might believe these crazy ideas. There was these theories that there'd been some form of natural disasters, volcanoes, earthquakes, and perhaps they'd released some form of fumes, some form of gases from beneath the planet's surface that therefore caused disease. So you can see how that fits with the idea of maybe bad smells. And they have this theory that perhaps it's to do with the planets being out of alignment in some way. So astrological reasons. None of them, of course, are really the true cause of it, but because they don't really understand the true cause of it and they believe it's this, they then develop ideas about preventing and treating it that are often based on these incorrect beliefs on the causes. So drinking mixtures of vinegar and mercury was seen as something you could do. I mean, drinking mercury is highly poisonous. It's going to be terrible for you. Bleeding, of course, bleeding is commonly used in order to balance out the four humours. There are some who have quite far out ideas of getting a chicken and rubbing it onto the areas where you have these buboes. So these buboes were like big boils on your skin that developed as a result of the plague. And there was this theory that, well, if you got a chicken, there's also some evidence that they used frogs as well and rubbed those on it with the belief that somehow they contained some form of property that would seep into the bubo and would heal you. Because they often have this idea that it's a religious cause of it, that maybe this is God's wrath, maybe God has sent this plague on everybody, you get a lot of people that are using prayer as a form of treatment. You also get these people, quite extreme people, known as flagellants, who are using flagellation. So this is where they are whipping themselves. These people often believed, well, it's perhaps the end times. Maybe this is it. Maybe this is God signaling the end times, and we best show now how devoted we are to God and that God does not need to punish us. There are some that believe that it is a punishment from God, that God is punishing the wicked and they should punish themselves first so that they're signaling to God that they do not need to be given this plague. So they often roam about the country, whipping themselves from town to town. But of course, in doing so, they often spread the plague even further than it may have already travelled. There's some evidence that people bathed in urine during this time, with the idea that maybe urine has some kind of properties that would clean you in some way. Urine had been used during this period for laundry. It was used to clean clothes, so there was this idea that maybe it could somehow clean you. And other ideas that actually were a bit more rational was that you avoided those that had the plague. So they do have this idea that actually if you came into contact with somebody that had the plague, it might be a good idea to stay away from them. It might be a good idea to avoid them in some way to prevent you from catching it. Now, of course, they don't understand how it could be spread from person to person, but there is at least some evidence there that they were trying to prevent themselves catching the plague by avoiding those who already had it. So they've got this idea that person-to-person contact can somehow cause it, but they don't know how. They also have this idea that you should just avoid having sex with anybody. Now you might think, oh, that's surely because they believe in person-to-person contact, and that's actually not. It's largely thought that to avoid sex is because they think too much excitement, that if you get too excited it could cause the plague. So actually in avoiding sex, they're actually preventing the transmission of it. That's really good, but that's not why they're avoiding it in the first place. They're avoiding it because they think, oh, you get a bit excited doing that, and that could cause you to get the plague. The key thing to remember with the Black Death is that religion and superstition play a really important and really significant role in people's ideas about how it's caused. And because that's how they think it's caused, many of their treatments and many of the ideas about prevention relate to those religious beliefs on causes. So we should pray, we should punish ourselves, we should bleed ourselves because we think it's inbound to the four humours, and so on and so forth.